Hi, my name is Ophra Leyser-Whalen, and I'm an assistant professor of sociology at the University of Texas at El Paso. And I'll be talking about my and my coworkers' paper titled, Just Because a Doctor Says Something Doesn't Mean That Will Happen, Self-Perception as Having a Fertility Problem Among Infertility Patients. So, some individuals who have the medically defined condition infertility adopt a self-definition as having a fertility problem, and others do not. So, in other words, people with similar objective medical situations have different subjective experiences of their inability to conceive naturally. And there's no clear consensus on why some people and not others adopt a medical label. So we use interview data from 20 women and 8 men who sought medical infertility treatment to understand variations in self-identification as having a fertility problem. We found that simultaneously integrating new medical knowledge from testing and treatment with previous fertility self-perceptions created difficulty for settling on an infertility self-perception, but 4 response categories emerged. The first group we call the non-adopters. Those are people who never adopted self-perception, either pre or post-medical contact. The second group we call uncertain, because they're not fully committed to a self-perception of someone as having a fertility problem, either pre or post-medical contact. The third group, assuming the label, didn't have prior fertility concerns, but adopted the self-perception post-medical contact. And the last group, solidifying a tentative identity, are those who weren't fully committed to a self-perception pre-medical contact, but did fully commit post-medical contact. Our data reveal that many people shifted their fertility identities as they progressed through the diagnostic process. Thus, interactions between women, men, partners, and physicians, in addition to the varied meanings of diagnoses and treatments, contributed to the constructions of an identity as someone with a fertility problem. Our results highlight the importance of identity disruption for understanding the dialectical relationship between medical contact and self-identification, as well as how diagnosis acts as both a category and a process. Moreover, men and infertility is greatly understudied, and I think that makes our results particularly interesting. In addition to increasing knowledge about the process of self-definition, or not, as infertile, the study of infertile self-perceptions contributes to broader efforts in the sociology of health and illness to understand the process of self-definition of non-life-threatening illnesses and illnesses where treatment is discretionary in the context of medicalized healthcare and professional diagnosis. For practitioners, this might be important because whether or not one fully embraces a medical diagnosis might affect their choices about future treatment options. Our results may also help for understanding other social situations where the temporal relationship between self-concept and behavior is problematic, such as delinquency, career change, or weight loss. Our results might also have implications for identity change as related to feared identities or role blockage, such as the death of a spouse, failure in school, incarceration, unemployment, and chronic illness. If you'd like to discuss our article, ask questions, or provide feedback, please email me at oleyserwhalen@utep.edu. Thank you.